Okay, go.
Hello, my name is Whitney Marcus. I am a Radiologic Technology student from Atlanta Technical College. I'm also currently serving as Student Government Vice President. I'm here today with Ms. Dawn Moore. Ms. Moore, would you like to give an introduction of yourself?
Sure. My name is Dawn Couch Moore. I am an assistant professor at Emory University in the medical imaging program. I have been a radiologic technologist for over 40 years, and I have been on faculty at Emory University for over 35 years. I have served in different capacities on faculty. I was initially an instructor, then the clinical coordinator, and I was the program director for 22 years. I am now just regular faculty as I am transitioning to retirement.
Okay, that sounds great. Thank you so much for that. I have a few questions for you. I'll just go ahead and begin. My first question is, please describe the importance and meaning of professionalism.
When I think about professionalism basically describes how well an individual adheres to a set of standards or a code of conduct or a collection of qualities that relate to their specific profession. So professionalism in radiologic technology deals with how well an individual performs the task of a radiologic technologist. Do they create quality images? Do they provide good patient care? Do they adequately protect the patient while they are acquiring images? So all of those are important characteristics of professionalism. So a professional radiologic technologist would exhibit those characteristics. Why is it important? It is important that we as a group, all radiologic technologists, know what is expected of us. What are our job tasks? How well they should be performed. And as a matter of fact, professionalism is so important in the American Registry of Radiologic Technologists Code of Ethics. It's number one. The first of the Code of Ethics platform says the radiologic technologist acts in a professional manner, responds to patient needs, and supports colleagues and associates in providing quality patient care. So professionalism is key in doing your job well as a radiologic technologist.
Thank you. The second question says, please give some examples of how professionalism can be observed in your workplace or the imaging occupation workplace.
When I think about examples of professionalism, there are some things to me that are very basic, and then there are some things that are more technical. So when I look at those basic examples of professionalism in a radiologic technologist, I think first of appearance. Is the technologist neat? Is their uniform pressed? Are their shoes clean? Do they have all of the required accessory devices that they need to do their job? Do they have a name tag that's displayed? Do they have their markers? Do they have their radiation dosimeters? Is their appearance pleasing to the patient? So that to me is just one of the most basic parts of professionalism. Do you look the part of a professional radiologic technologist? Another thing is demeanor. How does a technologist handle themselves when dealing with patients, when dealing with other healthcare professionals, when dealing with physicians? You know, do they communicate clearly and effectively? Do they use proper terminology? not layman's terms, but the terminology associated with our profession. Uh, just all of those basic things are good examples to me of the foundation of professionalism. Then, if we look at other aspects of professionalism, first I think of technical skills. Does the technologist have the knowledge to do their job well? Do they know how to perform the procedures accurately and efficiently? Uh, Another part of professionalism related to those technical skills is safety. Can they use the appropriate technical factors to minimize radiation exposure to the patient? Do they use shielding appropriately? Do they use collimation appropriately? Can they protect the patient from excessive radiation exposure? So again, to me, those are some of the basic examples that you would look for in a professional radiologic technologist.
Thank you. How can professionalism be applied in the workplace?
I think that professionalism has to be applied every day in the workplace. And when we think about those characteristics that are important to our profession, things that every technologist should do. The first thing is compassion. Every technologist should show compassion for the patient, for their situation. They should be respectful to the patient. Every technologist should be accountable. They should be accountable for performing procedures accurately, adhering to our national practice standards, which are developed by the ASRT, which is our national professional organization, making sure that they are adhering to the standards of ethics that are put forth by our national credentialing agency, the ARRT. So those are some of the ways that we can apply professionalism on a daily basis. And going hand in hand with those, I think comes integrity, being trustworthy, doing the things that you should do, adhering to those high professional standards, excellent, not just doing a job just good enough to get by. I mean, a patient's diagnosis and treatment depends on what we do. So I think that it's critical that we always strive for excellence to get the best possible images so that the patient can get the most accurate diagnosis. So, how do we apply professionalism in the workplace? I think every day by doing an excellent job, making sure we have good technical skills, we're applying safety procedures as applicable, adhering to ALARA, being accountable for our work, showing compassion for our patients, and just doing the best job that we can really do as a technologist.
Thank you. And the final question, what is one takeaway a student should know about professionalism?
I think that every student should know that professionalism should be inherent in your job as a radiologic technologist. It's not something that you go into the workplace and say, oh, today I'm going to be a professional. Tomorrow, maybe not. Professionalism should be part of who you are as a radiologic technologist. Every day you should strive to provide the best possible patient care, to produce the highest quality images with the least amount of radiation exposure while taking the best care of the patient that you can. Our job as an allied health professional is to get that patient the best possible diagnosis so that they can get the best possible treatment. And professionalism is tied into that every day. So it's not something that you put on and take off. It's part of your role as a radiologic technologist every day.
Thank you. And that concludes all of the questions.
Thank you for having me.